Hi, my name is Jamie Ruggiero, and I am so excited to be submitting this video today. So, I truly believe that all of my experiences have prepared me in such unique ways. However, I think my work at Mount Washington Pediatrics in their feeding day treatment program has definitely prepared me in a number of ways because while getting to work in the playroom setting with neurodiverse populations and typically developed children, I had the opportunity to look and explore what play can look like amongst different patients and while being able to also make assessments on patients routinely. Additionally, I constantly valued creating a safe and stimulating environment, and I got to advocate for patients during rounds and collaborate with members of the interdisciplinary team. And I think this experience definitely challenged me, but I believe that carrying out these responsibilities has familiarized me and given me the opportunity to practice the scope of child life in a very unique setting. In the feeding day treatment program, we experience a variety of patients with diverse needs, but in this instance, we had a typically developed 4-year-old who had select mutism. And this was my first experience with a patient who wasn't exactly nonverbal or had a cognitive delay, but wouldn't verbally communicate with the playroom staff or children. He didn't really have an issue engaging or interacting with us through play, but we really had to interpret his nonverbal cues as he if he was nonverbal. So in the playroom setting here, we really try to cultivate and promote a very comforting and nurturing environment in the playroom, and we were hopeful that through socialization with other children and exposure to the playroom setting that this would support and encourage the patient to use his voice. And after doing more research and familiarizing myself with select mutism, because I've never really had any instance like this before, I used my knowledge of child development and used play as a modality and tool to use his voice in a non-threatening way. And I started prompting him questions and incorporating play with little people and figurines and finger puppets and some of the characters that he may be familiar with. And knowing that animism and imaginative play are a huge factor that influences the pre-operational stage of development, in doing so encouraged him to start using his voice but for the use of play. So without forcing him to speak, he eventually started whispering and speaking to us with his for his wants and his needs and advocating for himself. And I simply will just never forget the amount of joy and excitement that I felt when he started to speak to us, and it really was just such a rewarding feeling. So I feel as if feeding day has definitely prompted a lot of challenges for me and difficult situations, but when reflecting back on my patients and experiences, there was this one school-age child who was on the spectrum and would use inappropriate language in and outside of the playroom setting. And these were behaviors that were addressed on his admission day, but at first we were kind of just told to ignore it. But after a few days, he became more and more comfortable in the setting, and he started to use his bad language towards the staff and other children in the playroom, and this became an even bigger issue when other parents became aware of his language in passing while checking in every day. So the patient's father would also never really step in or intervene and would kind of brush off this behavior. But as playroom staff, we have these set boundaries and structure, and we tried our best to implement all of those things, but it was extremely difficult in this situation. So then I decided that it would be best to reach out to psychology during his time in the program, and I asked for assistance in coming up with more of an efficient plan for this patient. And we frequently spoke with his primaries as well to come up with some advice or some help and guidance in how to deal with a patient like this. So starting off with the prioritization question, I believe that the VCUG would be top priority in being that this is the most invasive procedure, so I place this at the top. A 4-year-old could really benefit from medical play in this situation prior to the procedure, and to also discuss some of the procedural steps that they might encounter and educating this patient on why they are getting this and what it will do for their bodies and help them better understand will involve them in their healthcare experience. So, going down the list of number two, I did the unsedated MRI. And with knowing that this patient would be unsedated, I think it would be important to sit down and have a conversation, devise a plan or a psychological preparation with this patient, and just talk them through what they may encounter, sounds, sights, smells, even sensations that they might feel, and maybe just communicate with them and involve them in their healthcare experience. And I think ending this session with a coping plan or activities that they could do during the MRI to distract or comfort themselves would be really important to end with. So, even going further down the list, I did the mother who was tearful after their child went down to the OR. Emotional support and checking in with parents and caregivers is definitely a huge role and responsibility for child life specialists. And I think this can be done, but you have to go in knowing that it could be a quick session or it could be a lot longer than you anticipated. So you have to have the time to really sit down and devote time to caregivers if they need help with venting their stressors and concerns, or maybe some misconceptions, or maybe they just need a shoulder to cry on and need guidance from you. So for number four, I did attend the unit's monthly patient experience meeting, and I definitely think that rounds are so important, and um, it's a time and place where you as a child life specialist can advocate for patients and families and their needs, and it's definitely a priority. But if you have to miss it because you have higher priorities that day and a lot of procedures and patients and families that need to be met, that's why I put that there. Lastly, number five, I did clean and restock the toys in the waiting room. While it is still a very high priority, I put this last because while you do have to make sure the toys are clean, I think it's something that you can do when you have some downtime or you need a second to decompress from your day, and but you want to keep yourself busy. It's also something that you can delegate or ask for help with. If you actually need the toys to be cleaned, I think you can communicate to other staff members and say, hey, can you just clean up these toys real quick for me? Or if you have a volunteer, that'd be great too. With knowing how invasive and uncomfortable an NG tube placement can be, I think it's really important to assess the age of the patient, their developmental level, some past hospitalized experience, and also their tolerance to pain and discomfort. I think it would also be important as a child life specialist to assess their likes and things that can help them with distraction and comfort during this invasive procedure. Although this conversation might feel uncomfortable for a child life specialist, I think it's easy to understand that as adolescents, they can understand rules and reasoning as to why you wouldn't be able to share that information with them. And I would just be completely honest and cool about it and explain that it's unprofessional and unethical for me to be able to share that information about another patient. But I would simply address this with the patient and kind of redirect the conversation and ask about their friendship and ask the things that they enjoyed doing together in the hospital. I'd probably ask if they exchanged social media or phone numbers, and if they can keep their relationship outside of the hospital setting, then they can keep in touch this way. So when reflecting back on a lesson that impacted me, it was my first week in practicum, and there was actually an infant death in the emergency department. And the child life specialist invited me and the other practicum student to watch her and observe her as she engaged in legacy living with the baby. And I'd actually never seen a dead body before, and I was really nervous, but I really appreciated how empathetic and understanding the child life specialist was throughout the entire session. And I watched her paint her little toes and press her hands into clay, and she even cut a tiny piece of her hair. But while in the recess room, unexpectedly, the patient's mother walked in, and it was honestly a moment that is so chilling, and I will never forget it. But while I was trying to process what was happening and respecting the mother's needs, I was definitely trying to listen and observe to the child life specialist's language that she was using with the mother while she processed her daughter's death. And listening to her supportive but so professional language definitely left a huge impact on me, and I recognized that seeing this in practicum was so rare, and I tried to stay so present into the moment while taking everything in that I could get out of it. So I definitely think it left a huge impact on me. And although I may not be fully prepared to take on a bereavement on my own, it left me with some great takeaways and language starters that I could use for when experiencing a bereavement. So, if I could design my own clinical experience during the first week or so, I would still want to observe and become comfortable and familiar with the hospital setting. I would love to practice some role play preparations or play interventions during this time with my supervisor before carrying out these responsibilities independently with patients. And then, once feeling confident and well equipped and prepared, I would like to gain more experience in planning these interventions and facilitating them independently. Ideally, I would love to have a lot of constructive feedback and build a strong rapport with my supervisor because I feel as though I perform best when I feel supported and encouraged and comfortable with my supervisors. And during internship, I would like to experience as many units as possible and have the opportunity to work with different units and get a feel for what child life can look like on these different units. And during my last week in internship, I would hope that my supervisors would help me prepare for the transition towards being certified and getting ready to go. So, the word I chose to describe myself would be resilient. I chose this word because it truly embodies who I am and where I've been. There have been many instances in my life where I've wondered if I could make it through, and majority of things in life do not really come that easily for me. So I've had to jump through many hoops and tackle many obstacles for me to get to where I am today, physically, but also mentally. And looking back on all the trials and tribulations that I faced throughout my life, I think my passion and strong motivation for child life just grew larger and larger since I had to work that much harder to get to the point where I am today. An internship at INOVA would provide me with a variety of diverse experiences and units that I have not had the opportunity to be with. And I've actually never had the opportunity to work in a NICU or even be with a trauma level care. And knowing that you guys have a level 4 neonatal intensive care unit would help me give me a unique experience of working with the most fragile population and just knowing how child life continues to serve these vulnerable patients and families. I lack experience with infants, and I think that this is kind of my reservation, and I would enjoy having this experience and understanding the scope of child life practices with this specific population. And since INOVA is Virginia's only level 1 trauma center, I fear that I lack experience to provide or facilitate appropriate conversations to help support them through this traumatic crisis.